Good morning. Today is Saturday. This is our schedule. Saturday morning yoga therapy class. Sorry, I had to look at my cell phone to be sure the Facebook Live is active. We have been talking about a little bit esoteric side of medicine. Today we talk about a philosophy of medicine. As we all know, we all talk about, it's a medical science. It's a science, no question about it. But a major part of healing is also an art, is also a philosophy. Given an example, say, many of you may have heard the patient who survived 128 days after COVID-19. He has been to all the news media. His doctor was asked, what did you do for him to survive 128 days in the hospital and then went home? His doctor says, we did what the protocol says, we did everything what we could do, but he had two components which kept him going. The reporter asked him what? He said he had hope and support. Hope and support. We see it quite often, patients with cancers. Biggest example today is Alex Trebek, the stage 4 cancer of the pancreas, Jeopardy host. RBJ, Ruth Bader Ginsburg, Supreme Court Justice, also with the stage 4 cancer of the pancreas. They've been going for a long time. And when you talk to them, the word comes out from their mouth is all about philosophy beyond science. In our personal experience, we also see a person who's diagnosed with cancer. He or she said, that's it. There is no cure. I'm gone. They're gone. And the person says, okay, look at Jimmy Carter. He had a malignant melanoma, metastasis to the liver and brain. He had immunotherapy. He's 96. He got better. Oh, let me give it a try. They do survive. So today's topic will be our body, mind and spirit union, what yoga is. As all of you know, the word yoga means union of your body, mind and spirit. This is a philosophy, and philosophy is derived from called Vedic philosophy. And there is another traditional system of healing is called Ayurveda. Ayu means longevity, Veda means knowledge. And the origin of both yoga and Ayurveda is in the Vedas. There are 4 Vedas. These are philosophical books. Rig Ved, Sham Ved, Yajur Ved, Atharva Ved, and Ayurveda is a part of the Atharva Ved. I'll be telling you the concepts of philosophy of medicine based on the information we have in Vedic philosophy and Ayurvedic and yogic philosophy. Today we may have a little bit more discussion But we'll have a lot of practices also, like we all talk about today, the integration of the philosophy and wisdom of medicine with the science of medicine is going to be the 21st century medicine. Now, many of you have seen, but if you have seen my book tells you all about it. Here is my book. Many of you have seen by now, Yoga Therapy, Ayurveda and Western Medicine, a Healthy Convergence. I have explained the whole philosophy, then connected it to the science, modern science, and explained the whole philosophy in the term of medical terms. That if you look at the bottom, there are the two pictures. One is your Albert Einstein, another is your called Tagore, Rabindranath Tagore. Albert Einstein is the scientist and Tagore was a philosopher. And in the book, if you look at the cover of my book, it says front cover, designed by Shikha Sarkar, it's my wife. Watermark illustration of Albert Einstein and Rabindranath Tagore, where a scientist meets a philosopher. When the science and philosophy meets, it is a complete healing. Now let's first start. If you are comfortable, able to sit down in the ground. If not, sit in a chair. I have a chair in the back. And always remember, when you sit down in the ground or in your chair, always keep your spine straight. The moment you keep your spine straight, which is called Merudanda Achal, and keep your mind quiet, called Manasthir, you enter into a state where you appreciate beyond science. Even if you look at Albert Einstein, Einstein was a famous scientist in his younger days, but later in his life he was the biggest philosopher of our time. We as a physician, we're very science oriented. We're Western trained physician, we're very science oriented at the beginning of our career, but later on when we see that, I have done the same procedure, I'm a surgeon, I'm the same procedure, identical to patients, and outcome was different. Is it genetics? Is it pharmacogenomics? Is it nutrigenomics? We as a Western physician, we all talk about the same cure for all. But slowly and slowly, we've tried to figure it out that no, there is a different action of the different medication, different procedure, even in gender-based. Women doesn't react same way as the men because their altered hormonal homeostasis, their autonomic balance between sympathetic parasympathetic balance is different than a man. So it started called a gender-based medicine. Then you find out more that even ethnicity. We have the same medication for congestive heart failure. If you give it to a Caucasian, it acts differently in African Americans. There's different kind of diseases in rest of the world. Disease in Vietnam is different than disease here. We call in medical philosophy a balance between macrocosm and microcosm. So we had ethnic-based medicine. Then you started finding out every individual is different. In Ayurveda, they call it a doshas, called psychophysical body type, called Vata, Pitta and Kapha. One is very mobile, one has attributes of fire, one has attributes of water, and earth is a grounding. I talked about a lot, did Ayurvedic yoga therapy. You can go back to my YouTube channels, you'll be able to see it. In Western medicine, we talk about it as a genomics. So we are different probably genetically. But you know how different is genetically? There's very hardly a few genes which are different in two human beings. So this is all about what you call a mind. Now let's discuss few concepts of philosophy of medicine before you start practicing. But your biggest practice today is able to sit down comfortably with your spine straight, or maybe even eyes closed, paying attention to your breath. So practice it. The lung is like a balloon. It has a 4-liter capacity or 4.5-liter capacity, which is called a vital capacity. We only breathe 0.5 liter. 80 to 90% lung is a reserve. So the practice is that breathe out first. This is a balloon. You need to empty the balloon. Then you need to practice the effortless breathing. Say, count of 2 in, count of 4 out. Okay, let me show you even if you're in a chair. So I have a chair in my back. So when you sit down in a chair, if you sit in the front, always keep your spine straight. So it will look like you're in a 90 degree. You're in a 90 degree in your body in shape. Even if you go to the back, you'll see you always keep your spine straight. This is the way you are going to use your computer. This is the way you're going to eat your food. This is the way you drive your car. Once you do that, that relaxation response will come in. Parasympathetic activation will come in. You will appreciate more and more what is beyond science, what is in philosophy of medicine. So let's continue a practice which I want you to do throughout the whole day, is that keep the back of your mind, always sit down with your spine straight. Use your hand as a mudra. Touch your index finger and thumb. The hand connects your body and mind. And have you seen that our hand moves before you even can speak? Like I say something very nice, I see. You see something beautiful, you say breathtaking. So touch your index finger and thumb, put it over your knees, close your eyes, and just practice an effortless breathing. If you can balance yourself, that is another practice. Always balance, because I'm right-handed, right-footed. I'm not using my left side of my body at all. This is called lateralization of the brain. Lateralization of the brain pulls us down to the level of true science. Right-handed, left brain is analytical, left brain is hitting, left brain is male, but we need to go into the right brain. Right brain is intuitive, right brain is female, right brain is cooling. When you bring the balance back through the balancing postures or doing a daily sun salutation, alternate nostril breathing, you will enter into the state of where you will be able to access this esoteric philosophy of medicine. So let's all of us keep on practicing, And let me explain a little bit more and more to you what is the philosophy of medicine means. Very, very important for complete healing. So if you can sit, keep your feet a little separated. A lot of people tells me my feet doesn't touch the ground. You can put a folded blanket or folded any folded sheet. And the reason for folding is that you will develop slowly and slowly a neuroplasticity and you will be able to remove it. So if you can sit down, you can put your 1 foot high up, do the Dhyana Mudra, close your eyes, breathe out, then you keep practicing very gently, breathing in, count of 2 in, count of 4 out. Count of 3 in, count of 6 out. Count of 4 in, count of 8 out. Continue like that, count of 6 in, count of 12 out. Count of 8 in, count of 16 out. We've been practicing for so long, we can do a count of 10 in, count of 20 out, but completely effortlessly. Effortlessly means that you can talk, you can even sing at the same time. After a while you will feel that you're developing a profound level of relaxation. This is called the stages of asanas. The first is called arambha. A muscle is contracting to put me in this posture, but I'm in this posture with the hand mudras, my eyes are closed, I'm doing the breathing out longer than breathing in. Breathing out, exhalation is parasympathetic, inhalation is sympathetic. The muscle starts to do a little fasciculation, and slowly fasciculation goes away. You enter into a profound relaxation. Second stage is called sthiti, stability. Finally it's called visarjana, profound relaxation. So when you achieve that state, what you do, go ahead and bring the opposite foot higher. And continue this practice, and if you cannot progress any further, so you can do only today, count of 4 in and count of 8 out, keep doing it. When you keep doing it, what happens? The muscles of respiration relaxes. When the muscle of respiration relaxes, your breathing gets effortless. Breath is the connector between your conscious and subconscious mind. What does it mean? Even you look at the level of the brain. Let me come down and sit down. I mean, many of you are able to sit down. When you can sit down, put your feet under your knees, keep your spine straight, and sit down in a profound level of relaxation will set in. But once you're sitting for a short time, when you feel the level of relaxation, you change your foot. Change your foot, you activate both sides of your brain. So let's continue the practice and let me continue the discussion. So here is your practice. Touch your index finger and a thumb. Close your eyes and breathing out longer than breathing in, and do not do any competition. We'll go a little bit more and more practice and explain to you. Now let's talk about first is called the layers. Layers of your body. The layers in Sanskrit called koshas. And what does the koshas means? Koshas connects with your bodies connects to your called chakras. And let me explain to you first koshas. In our Western medicine, we learn the anatomy by dissecting a dead body. Then you find out this body has a function which is called physiology. The physiology alters, becomes a pathology, and in a pathology we do the diagnostic maneuvers, then you bring a therapy, either external or internal intervention, and this is the end of our science-based Western medicine. So the first layer or koshas is called Annamaya kosha. Anna means food. We have all the inputs in the food, water, all the intake. This is our gross body. Second, the function, the most important function in our philosophy is called your breath. God made us from a dust or from clay and gave us the breath to be alive. Physiology means I'm alive. The physiology is called, in yogic philosophy, called prana. You keep on doing your breathing, and just listen to my discussion. We'll have a little bit more discussion today because this is the philosophy of medicine. Prana in yoga and in Chinese medicine they call qi. Every traditional medicine has the same concept called a life force. It's an energy. It is a non-measurable energy. It's not like an electromagnetic energy. It's not any other measurable energy. It's a non-measurable energy in my body, and breath is the carrier of the prana. Metaphorically, prana is like electricity and breath is the electric cable. Keep doing your breathing. Count of 4 in, count of 8 out. If you can progress, count of 5 in, count of 10 out, and just slowly listen to me. So the physiology is prana. Prana keeps us alive, physiological. So it is called Pranomaya kosha. Prana is your, Maya is the layer, Maya is there, and the kosha is the layer. Annamaya kosha, Pranomaya kosha. Then yoga philosophy believes that this body has a mind. That mind is called Manomaya kosha. Mind in Western medicine is regarded as abnormal neurotransmitters. My serotonin goes down, I get a depression, my mental, or my dopamine, we call it a dose, dopamine, oxytocin, serotonin, endorphin. But in yogic philosophy, mind is regarded as the content of our 5 senses. I hear, I see, I smell, I taste, and I touch. All the information which comes through my 5 senses, I put in a container, that is my mind. And that mind gets balanced with a practice which is called Bhramri Pranayama. Bumblebee breathing. So we'll be doing the practices which you do it every day. It is just we do it. The yoga therapy means pick and choose based on what you are doing on that day, what you are discussing on that day. Our recommendation is to do a complete healing. You do 1 hour of practice a day, 25 minutes of asanas, 25 minutes of pranayamas, and the breathing technique, and 10 minutes of meditation. So we'll do a bumblebee breathing, Bhramri Pranayama. In a bumblebee breathing, we shut down all of our 5 senses. Then you create a frequency. And that frequency has the same frequency as our brain. 2 frequency interacts, called a harmonic resonance, and the mind quiets down. Mind is the site of all the chronic diseases, we call it non-communicable diseases, NCDs. Yoga therapy is a wonderful therapy for NCDs. And let's go a little bit more before we practice a bumblebee breathing. And also remember, the yoga has a sound of Om. Om has the same frequency as the frequency of your brain. Same harmonic resonance is a principle of physics takes place. When the contents of your mind gets more processed, it is called your wisdom. In yoga philosophy, it's called a buddhi. Wisdom is your intellect. The fourth sheath is called intellect. Intellect is your called Vijnanamaya kosha. Vijnana is your intellect, kosha is the sheath. See, when I am even doing talking, I'm on a mudra, called Jnana mudra. I can feel I have some saliva in my mouth. That means I'm having some parasympathetic activation. Even I'm touching it, I can feel the capillary pulses. My feeling slowly and slowly is going down. This is called a state of meditation. We're entering into state of meditation. It's called a seventh limb. In Vijnanamaya kosha, we are also very balanced and rational. And that your intellect get processed a little bit more, it becomes your wisdom. You are wise. And that is a blissful state. That is called your Anandamaya kosha. Ananda means your bliss. You have a blissful sheath. So what does all the 5 sheaths has to do with your medicine? Let's take example. I give example quite often. We can take example of any disorders, but say we talk about asthma. Asthma in the physical body is an inflammation, is a constriction of bronchioles, is a tightness, not able to breathe, the problem with the breathing. So there is a loss of balance in our physical body, Annamaya kosha. When there is an imbalance in the physical body, it shows up in my breath. I cannot breathe properly. I can breathe in, but I cannot breathe out. I have a problem in breathing, shortness of breath. When I have a shortness of breath, my mind alters. What happens? I'm very agitated. I don't know, I cannot breathe. I'm very anxious. I'm very panicky. So mind gets your imbalance. When the mind is in imbalance, Manomaya kosha, then your judgment, your intellect gets in imbalance. That is called Vijnanamaya kosha. When intellect gets imbalanced, your bliss, your final balancing of your body, mind, of spirit get totally imbalanced. So it affects all of your 5 levels. So for a complete cure of your asthma, you need to correct all the 5 sheaths. On the other hand, if you look at from top down, at the level of the blissful sheath, Anandamaya kosha, we are in a balance. Our body, mind and spirit is in balance. Completely healthy. We cured all of our diseases, complete cure of the diseases, and complete healthy. We have seen the yoga practitioners in India or even the rishis who have been practicing yoga and meditation, they live 80, 90, 100 years totally, completely disease-free, medication-free, a quality life. So at the levels, 4th level, the intellect level, Vijnanamaya kosha, you start to have some imbalance between your body, mind and spirit. But your intellect pulls you back. So don't do it. So you're still healthy. At the mind level, Manomaya Kosha, all the imbalance in the body, mind and spirit starts. So the root cause of all the non-communicable diseases, which we call endogenous disease. We have two types of disease. One is called exogenous disease, it comes from outside, infection, allergies. But endogenous disease, which comes from inside, which we call NCDs, non-communicable disease, the cause is at your mind, Manomaya Kosha. By the time the imbalance comes in your breath, your breath will be abnormal. So look at a person who is stressed. There will be rapid, shallow breathing. So rapid, shallow breathing, a person sitting in front of you, as a physician, when I see, I'm looking at his or her breath, I know something is not right with this patient. See, as a primary care physician, my friends always tells me that as a primary care physician, I see 80 to 90% people with a functional disorder. I talk to them a little bit, I quiet their body and mind, and they leave my office very happy. It is called the physician-patient relationship, and in yogic tradition is called the healing of the touch. When you touch your patient, patient gets healed. Today, we as a physician, we always examine the patient, physical examination. Today, physicians are relying on more on blood work, imaging, to treat the patient's chart rather than the patient themselves. Very, very important concept. So, I have only 5 to 10% people who has organic disease as a primary care physician. When I look at the person, I know something is going on. By the time it comes to our physical body, called Annamaya Kosha, Ayurveda and Yoga says it is already too late. When I have a diabetes, when my blood sugar is up, when I have hypertension, I have a coronary artery disease, it could be even prevented. So Yoga and Ayurveda primarily is a preventive medicine. So let's practice what is to quiet down my mind, how to control the Manomaya Kosha. This is the controlling of the Manomaya Kosha. Keeping your spine straight, because the muscles, paraspinal muscles, were contracting to keep my body straight. I'm in a state of a hyper muscle contraction. Keeping my spine straight, I'm giving a relaxation to the paraspinal muscles. Able to close my eyes, I'm literally shutting down my external extension of my brain. Remember, eye is the direct communication to your brain, because the optic nerve goes straight to the brain, and also eye is supplied by about another 4 cranial nerves. SO4, LR6, the muscle called superior optic, supplied by the 4th cranial nerve. Lateral rectus, LR6, lateral rectus supplied by the 6th cranial nerve. It's a large number of cranial nerves. Able to close your eyes, or able to do your eye movement called tratak. And then the breath. Why? Breath is the connector between your subconscious and conscious mind. I'm sleeping, I'm breathing. That is the function of my brain stem. My brain stem has an automatic autonomous nervous system. But I am awake, alert, I can breathe out, I can take a deep breath in. That is the function of my cortex, upper part of the brain. So the breath is connected between my brain stem and my brain cortex. Brain stem is unconscious and cortex is conscious. Consciousness is the philosophy of medicine. So the psychiatrist came and asked me, will you explain to me consciousness? I said, sure. Human being is conscious about consciousness and remain unconscious, not to understand consciousness. When you see somebody unconscious, what do you say? He is senseless. That means when your five senses are not properly working or balanced, you get unconscious. That comes back in the fifth limb of yoga. It's called pratyahara. Pratya means reject, ahar means input. All the input you get from the five senses. So, I'm very relaxed. If you're sitting in a chair, stay there. But here, I go to the next relaxing asana. It's called your Siddhasana. I put my heel all the way to the back. I took my one foot in the top and my knee drops down because I'm in a state of relaxation. If it is staying high up, let it be high up here. Don't push it down. If you push it down, it'll come back higher. So what happens, the practice is your individual. The practice is no pain. If you feel any pain in this posture, you back off where you don't have any pain. Then effortless breathing. If you don't have any pain, the effortless breathing, you continue on the practice. Now if you're practicing with me, let's practice 2 pranayamas to quiet down your mind. First is a Brahmari pranayam, bumblebee breathing. Then is your Unulom Vilom pranayam, alternate nostril breathing. Why alternate nostril breathing? Because alternate nostril breathing activates both sides of your brain. And if we do it in the balancing, say I'm doing it in my balancing asanas. So let me show you another balancing asanas. Now I'm going to take my left foot on the top. This is called your Ardha Padmasana or a Swastikasana. When I feel a little relaxed, what I will do, I will take the other foot high up and slowly I will enter into called Padmasana, a lotus pose. You have all done it with me before. Let's practice about 3 times the bumblebee breathing. Use your index finger, put it in between our eyebrows. This is called the third eye. Use your 3 fingers to close your eyes and then use your thumb to close your ear. You'll be doing all the breathing through your nostril. You breathe out first through your nostril. Take a deep breath in. Breathe out with the sound of a bumblebee. Take a deep breath in. One more time. Breathe out first. Take a deep breath in. Completely breathe out. Slowly take your both the hands. Keep rubbing your hands. It's called palming and cupping. Wonderful relaxation. We do this practice all the time, but I'm connecting these practices to all the philosophy of medicine. The warm, if you're wearing glasses, remove your glasses, put your hands over your eyes like a cup. Let the eyes take all the heat from your hand. Massage your forehead, massage your eyes, massage your face, but primarily massage behind your ear, in front of the ear, auricle, in front of the ear called a tragus, also even inside the external auditory canal. There is called the auricular branch of the vagus nerve. The vagus nerve is your relaxation response. Vagus nerve is your parasympathetic activation. So you are vagus nerve. Then when you slowly bring it down, you massage your neck on both sides. There is called a carotid sinus. Carotid sinus is the bifurcation of the carotid artery. Carotid sinus is being massaged to activate your parasympathetic activation and quieting down your cardiovascular system. As you know, when you have a supraventricular tachycardia, when heart rate goes high up, we massage the carotid sinuses. So wonderful practice. Now, on these 5 layers or 5 koshas, the Vedas describe the 3 bodies. Bodies connected through your body, mind and spirit. The name of our topic is Yoga Therapy to Balance Bodies, Koshas and Chakras. We'll come to the chakras a little later, and we'll show you the balancing of the chakras with asanas, pranayamas, mudras, bandhas, and then a vibration called mantra. We finish with a called chakra awakening meditation. These are very esoteric practices, but these are real for complete healing of our body, mind and spirit. The first layer, which is called Annamaya Kosha, the layer which connects with my physical body, is called your gross body, physical body, and Sanskrit is called your Sthula Sharir. Sthula means your gross body. Sthula Sharir get balanced with a relaxation response, which is called your Sthiram Sukham Asana. Sthiram means stillness, Sukham means happy, Asana is a posture. This is also balanced with a practice of which every asana will be feel like a savasana, hot pose. Completely effortless, completely relaxed, and I'll show you a very quick practice. And I want you to keep this practice in a toolbox. It will be a prayer pose to the back, will be called Paschim Namaskar, with a relaxation of the neck called Brahma Mudra. We'll do it at the same time to balance and relax your gross body, called Sthula Sharir. Sthula Sharir also get balanced with your balancing asanas. Like here, I have the left foot high up with a Ardha Padmasana. I'm very relaxed, so I'm going back to putting my right foot high up and doing a Ardha Padmasana. Now, if you feel a pain, what you can do, you back off. Even if you feel, you can back off later. But start somewhere, so keep it here. I'm very comfortable in this Ardha Padmasana. Next 3 koshas, the koshas of the sheath are called Pranamaya Kosha, which is your breath sheath, Manomaya Kosha, which is your mind sheath, and your Vijnanamaya Kosha, your intellect. These 3 koshas constitutes a body which is called your body of your mind. and it's called a subtle body. Gross body called a subtle body, and in the Sanskrit, the language which yoga is written, is called your Sukshma Sharir. Sthula Sharir, Sukshma Sharir, gross body, subtle body. Subtle body get balanced with the fourth, fifth, sixth, seventh limb of yoga. As you all know, yoga is a philosophy. It's called Yoga Sutra of Patanjali. 196 sutras, small aphorism, of which 193 is all about balancing your mind. Manasthi. Practice is called 8 limbs. Patanjali Ashtanga Yoga. Yam, Niyam, Asana, Pranayama. Yam is a social restraint. Niyam is a personal restraint. Asana is the alignment of my body, internal and external alignment. Pranayama is able to control, restrain your prana, yam. Then comes pratyahara. Pratyahara is the reject. Ahara is your input. Then is your dharan, is the focus. 7th limb is meditation, dhyan. 8th limb is called samadhi, which is the union of your body, mind and spirit. So you really don't practice yoga and meditation. Meditation is the 7th limb of yoga. Meditation is yoga. So for your subtle body, it gets balanced with your pratyahara, able to control your 5 senses, dharan, able to focus your mind, and entering into meditation. Meditation is a state where you enter in between your thought process. We have thousands and thousands of thoughts. All the thoughts are primarily in your past, another good portion in the future, very little in the present. And when you live in the present, almost 90-95% thoughts are repeat thought process. I have to start in the morning, I have to talk about philosophy of medicine, it's continuously chattering my mind. Called chitta vritti nirodha. It is controlling the chattering of your mind. We enter in between the thought process. It is called a gap. Slowly and slowly widen the gap. We still have the thought process. We are not thoughtless, but we are very comfortable. We stay calm in the middle of crisis. That's our meditative state. Meditative state balances. Another balance for your Sukha Sharir is able to remove the negative emotions in your mind. Positive emotions is a healing. Negative emotion prevents our healing. In yogic tradition it says, when you breathe in positive emotion and breathe out negative emotion. So beautifully being explained in whole yoga and Ayurvedic philosophy. So you're breathing in positive emotion, breathing out negative emotion. Everything you have, all the egos, all the jealousies, you can name any of the negative emotion comes out, the exhalation. So let's, before we practice our gross body, the third body is called your causal body. Causal body in Sanskrit is called Karana Sharir. Karana Sharir is connected to your spirit. And what is spirit? Basically, spirituality means I believe in a power above me and I surrender. Remember, spirituality has nothing to do with religion. Religion is a law-based. Religion is a guidance telling you what to do, what not to do. Spirituality is introspection, looking inside yourself, listening to your inner voice. What is inner voice is saying? We have one of our very famous yoga teacher. Actually, she is here. She's in the class listening to us. Our Linda Robinson just wrote a beautiful article, Listening to Your Inner Voice. When you're listening to your inner voice, what you do, you awaken the doctor within you. You have a doctor within you, and you find out for all the non-communicable diseases, I am the cause and I am the cure. How is it possible? I have a diabetes. I go to see my doctor every 3 months, 6 months, 1 year. He or she checks my hemoglobin A1C, gives me medication. It's great. But if my blood sugar goes up today, I'm the only one who knows what I eat, who did I fight with, who did I curse, what was my state of my mind, what was the state of my spirit. I know exactly what raised my blood sugar. And nobody else knows it. Also what happens, in this state, in this causal body, you have a transformation within your body, mind and spirit, which only you can experience, and you have no language to express. So what are the healing substances? So remember, I'm going back and forth again. The healing substances for the gross body, which you'll do, is a relaxation response called Sthiram Sukham Asanam. Healing substance of your subtle body is removing your negative emotions through a longer exhalation, and also exhalation is parasympathetic. Healing for your causal body, the first is your self-discipline. Self-discipline in yogic tradition is called a dharma. Dharma is a state. Dharma is a guidance from within you, guidance from yourself. Self is inside, self is within you, guidance from yourself, which keeps you in balance between microcosm and macrocosm. Jatha pinda tatha brahmand. Dharma has a lot of definition, lot of explanation, but basically it is a guidance from within you which keeps you balanced between macrocosm and microcosm to be healthy, happy and peaceful. Self-discipline is the therapy for your causal body. Self-discovery. Self-discovery means I'm discovering who am I. Who am I is the question, the spiritual question. There is thousands and thousands of the books being written. Who am I? Self-discovery. Self-discovery is introspection, looking inside, finding it out. I am the cause and I am the cure of all the endogenous disease I have. Self-realization. Self-realization means I develop my real eyes. What is my real eyes? My eyes are now turned backwards. Instead of looking outside, I'm looking inside. I'm trying to see what I have done to get this diabetes, what I have done to get this coronary artery disease. This is the root cause of a disease. We as a Western trained physician, we are treating at the tertiary level, at the Annamaya Kosha level. Yoga and Ayurveda are treating you at the level of your Anandamaya Kosha, the fifth koshas, which is your causal body, removing the root cause of the disease. That's what happens to all of us. We are practicing, we do daily practice. We are disease-free, medication-free, enjoying quality life, even whatever happened to us in the past. I had a triple vessel coronary bypass. I have a lot of friends or people who are practicing with us. Parkinson's disease, multiple sclerosis, diabetes, hypertension, enjoying a wonderful quality of life. So coming back to the gross body now, so now remember, so removing the negative emotions is your Sukshma Sharir, causal body. Able to remove your lot of emotion in the spiritual level, if you have a sorrows, but at the spiritual level, self-discipline, self-discovery, and self-realization. So now I'm here, now I can take the other foot, bring it up, I can easily sit down in the level of your Padmasana. In a Padmasana, even if you're sitting in a chair, you will be able to do it, and you take your hands all the way to the back and do a prayer pose to the back. And I've shown you more and more every time you class in, I show you the prayer pose, but just let me show it to you and let me show you the daily practice, which I also do to balance my gross body. So here it is. If you look at here, slowly I take my hands, wherever it is. Remember, you start where you are. And slowly I can put it down at a prayer pose. And then slowly I can get it higher. And my spine is straight. My eyes are closed. I'm breathing out longer than breathing in. I'm breathing in, count of 4 in, count of 8 out, count of 6 in, count of 12 out. And then let's see when you do it, your hands is going to go higher. Slowly and slowly go higher. You feel a profound level of relaxation. Even if you're sitting in a chair, you can see if you can do it. Call prayer pose to the back. Paschim Namaskar. Then what you do, in a Paschim Namaskar, you will come back and see all these things we have done already. I'm just showing it to you. As I said, for your mind, you will need bumblebee breathing, primary and alternate nostril breathing, which we have done, and I will show it to you a little bit later. So let's put the prayer pose to the back. It's a prayer pose to the back. Yeah. And then I incorporate the relaxation of my neck. It's called Brahma Mudra. 4 position of my neck, and I will do it with the sound of my bumblebee. So let's practice. It's a wonderful practice. When you do this, you will find, in fact, this will call the balancing of your gross body. It will lead you to the balancing of your subtle body, because you will be removing all the negative emotions through your exhalation that will enter into the state of self-discipline, self-discovery, self-realization. Okay. We'll slowly put your neck to the back with the breathing in, and breathing out we'll use your bumblebee sound and keep on going down. And if we feel any pain, we'll back off and have an effortless breathing. So your body's your warning system is a pain and effortless breathing. Why effortless breathing? Annamaya kosha to pranamaya kosha. Any imbalance you create in your physical body shows up in your breath. So as I said, if you practice completely effortless breathing, you will never be able to hurt yourself. So the question about all the injuries and problem with humans. So in all yoga practice, you breathe out first. Take a deep breath in and slowly put your neck to the back. Breathe out with a bumblebee breathing. So, when you're going down in the neck, a lot of my physician friends ask me, I have a cervical radiculopathy, I have a previous surgery on my disc, I have nuts, bolts, screws. Nothing is going to bother you, nothing is going to hurt you if you listen to your body's signal. If there is no pain when coming down and my breath is effortless, I will have no problem, I won't be able to hurt you. Always remember, do not practice with a pain medication on your board. Do not take a 2 pain medication and do this practice. Number 2, you do on both the sides, same technique. Breathe out first. Take a deep breath in. On the left side. Deep breath in, right side. Look all the way to the back without turning your shoulder. Breathe out first. Take a deep breath in. And always notice that I do the practice with my eyes closed. My eyes are closed, they enter a profound level of relaxation. Finally rotate your neck on both sides. First one to the left, to the back, to the right, and right to the left, to the back. Same breathing and same vibration. Drop your head down, breathe out first and take a deep breath in. These are daily practices. You see, my hand is still behind. In fact, the hand is going high and higher and higher. There's a profound level of relaxation. This is my daily practice, and also when you can balance your gross body, you slowly enter into your subtle body. From body you enter into your mind, subtle body. When you get into the subtle body, you feel a profound level of lightness in your body and mind. In fact, when you're doing it on laying down on your mat, you might feel even sense of levitation. Initially it may not happen, but in the practice it does. Even if you see me here, I'm going to show it to you. This is called Koshasana. Put your hands on the side. I push my hand, my whole body goes higher and stays higher. You don't feel much weight in your body and mind. This is called your Tulasana, raising your whole body higher. It's wonderful practice for improved body. Another one is called Mudras. The Yoga Mudra. Yoga Mudra is able to sit down. The hand has a mudra, it's called hand mudras. We have mudras in our eyes, we have mudras in our neck, mudras in our tongue, Khichari mudra, and also mudras in our, like Indian dance called Bharatanatyam. In Bharatanatyam it says, whatever movement you do your hands, it touches your eyes. What touches your eyes, it touches your mind. Body, mind get balanced, and this is called a dance yoga. So hold your left wrist to the back. Keep your spine straight, if you can. Look straight. Breathe out first. Take a deep breath in. Completely breathe out and slowly bring your body down. Listen to your body's signal. There is no pain. As an effortless breathing. Bring your head, come down, all the way down, and you're able to stay here. Able to stay here about 5 to 10 breaths. 5 to 10 breaths, breathing out longer than breathing in. Beautiful practice. Another very wonderful practice we have shown you many times, relaxation of your hands, is called the Bala Mushti Mudra. Put your thumb inside and close. Your wrist relaxation, shoulder relaxation, your feet, separating your toes, your feet and knees and hips. These are very beautiful practices. But one very important practice you do that will show it to you, that able to sit down in a, called your squatting pose. This is called your squatting pose, Malasana. And if you get your hands get relaxed, if you separate your fingers like this, if you separate your fingers gets relaxed. You extend your wrist gets relaxed. Put your one elbow inside, another elbow inside. Slowly bring it close to you. Keep your spine straight. Close your eyes. Breathing out longer than breathing in. Breathing in positive emotions. Breathing out negative emotions. Balancing your subtle body. Start looking at your self-discipline, self-discovery, self-realization, removing the root cause of all the non-communicable disease. Able to get up without a support is called a sit-rise test. It's a wonderful practice. And then, many of you are sitting in a chair, so let's sit down in a chair and do another practice. It's called Sun Salutation in Chip. In Sun Salutation is a complete yogic balancing practice for your body and mind. And Sun Salutation has a 12 asanas. There is a 12 breathing. There are 12 mantras. Mantras, remember, mantra. Man is your mind, tra is your quieting down and vibration. Mantras quiets down your mind. Mantras are the words which has a meaning, but the way you pronounce. So let me just give it to you. I have all of them in my book. You can see it, or in my DVDs. So the asanas, the name of the asanas, and we'll do it slowly and slowly. Go to the Pranayama, put the hands together, and we do breathing. Like you'll be breathing out or breathing in. If you start breathing out, you'll end up with breathing in. If you start breathing in, you'll end up with breathing out. Then there are mantras, the 12 mantras. The mantras are called first Om Mitraya Namah, Om Ravyaya Namah, Om Suryaya Namah, Om Bhanave Namah, Om Khagaya Namah, Om Pushne Namah, Om Hiranyagarbhaya Namah, Om Marichaya Namah, Om Adityaya Namah, Om Savitraya Namah, Om Arke Namah, Om Bhajarasana. 12 names of your sun. So yogis back home, what they did, they wake up in the morning, they looked at the sun and they did the sun salutation. And we'll show it to you again, that when you come to the chakras, we'll talk about the chakras. That's what happened. When they closed their eye, they saw a color. So let's do the 12 steps with the breathing. Mantras you do very gently and silently in your mind. So here you're grounding your feet, put your hands together. It's a Pranayama. A lot of people ask you to have a chair without a handle, but what I noticed is if you have a chair with the handle for people who are doing a, say, a spinal twist and spinal movement, it is all, and I like to have the little support. Suppose I'm looking at the back, I hold my hand to the back, on the right hand, breathe out, slowly twist my body, it gives my spinal relaxation. It's a wonderful practice. So this is good with a little handle. Starts with breathe out, or Pranayama. Hasta Uttanasana. When you do the hand raising up, you follow with your index finger. The one best way, if you can see, if you can fold your other fingers down, if you keep your index finger straight and the thumb together, and you took all the way to the back, it is called breathing in. And do the mantra Om Ravyaya Namah. Then Hasta Padmasana, touching your hand to the feet. Slowly bring your hands down. If you can come down, you can actually support yourself. Slowly with the support, you can come in the front. Put your hands there. Also put your hands on the side. And you're breathing out. Om Suryaya Namah. Then slowly get up. It's called Assassination. Breathing in, you put your hands, try to bring it close to you, and push your other right foot in front. Open your chest, look high up. Breathing in, Om Bhanavaya Namah. Then you do your Padmasana. Slowly bring your right foot close to you. If you can bring it, bring your head down, touch your head to the right knee. Breathing out. So, Khagaya Namah. Then drop your feet down. It's called Ashtanga Namaskar. You put your both the feet together. And if you see, we touch the eight parts of the body when you're laying down on the mat. So slowly the same way, we put our hands down
and hands on both sides, and try to get your face almost to the level of your ground. Ashtanga Namaskar, it will breathe in, Om Pushnaya Namah. Then you, from there you get up into a Bhujangasana, put your hands together, feet together, open your chest and look high up. This will be breathing out, Bhujangasana, Om Hiranyagarbhaya Namah. Then you go back to your other side. Parvatasana. You can do on the same foot, but when you do the other side, it completes your one cycle. You bring the high up, to head down, touch your head to the knee. Parvatasana. Om Marichaya Namah. Breathing in. From here, you do your Assassination, trying to bring your knee towards you and kicking your feet out. Open your chest and look high up. Horse riding, Assassination. As you're breathing out, Adityaya Namah. Then drop your feet down, separate your feet, come back again in a Padmasana, touching your hand to the feet, slowly bring it down, put your hand down, this will be your breathing in, Om Savitriya Namah. Then slowly get up again, do your hand raising pose. This will be breathing out, Om Arke Namah. And slowly bring your hands in front, Pranayama. Breathing in, it's called Om Bhajarasana Namah. Started from the breathing out, ended with the breathing in. And had the 12 mantras. Now let's do one more. Just we'll be doing without any mantras and just show you the steps and doing it with breathing. This time we'll start with a breathing in. Last time we did breathing out and did with breathing in. Now we start breathing out first. Breathe in. Hastottanasana. Padahasta asana, breathing in. Assassination asana, breathing out. Parvatasana, breathing in. Ashtanga Namaskar, breathing out. Bhujanga Asana, breathing in. Parvatasana, breathing out. Assassination, breathing in. Padahasta asana, breathing out. Hasta uttanasana, breathing in. Pranayama, breathing out. Started with the breathing in, ended with breathing out. Wonderful practice. Do it every single day. We say guaranteed you will be removing the root cause of the disease. Disease, spell it D-I-S-E-A-S-E. This is, the therapy is called effortless ease. When you can practice effortlessly or effortless ease. So this was your 5 layers called koshas, 3 bodies. Then yogis had looked at a potential energy in your around the kind of spine. And what they noticed it, that when they are in a state of dis-ease, they call it a ashuk, suddenly they feel there is an energy which is flowing along the spine of their spine, and they feel like it is a snake moving along the spine. They used to call them a Sanskrit name called Kundalini Jagaran, awakening your serpentine power. So the concept here is, let me tell you the concept, and you'll be surprised, how the philosopher can describe things at that time, 4,000, 5,000 years back, which is still a science today. When they closed their eyes, they saw some color. When they saw some color, they were looking at the nature, and the color of the nature they noticed was your color of the rainbows. Color of the rainbows had 7 colors: vibgeo, violet, indigo, blue, green, yellow, orange, red. They felt like these 7 colors are representing the 7 centers of potential energy along the line of our spine. They looked at it like a wheel, they call it chakras. Chakras means wheel. And when they look at about the energy of their body, called subtle energy, called prana, which keeps us alive, they felt like that there is a main channel through which the spinal cord flows. It's called Shushumna Nadi. There are 2 channels which starts at the root of your spine, and it crisscrosses and comes out, one through the left nostril, one through the right nostril. One comes out of the left nostril, is called Ida, which is cooling, which is like a moon energy. Left nostril is controlled by the right brain, and right brain is also cooling and intuitive. Other one comes out to the right nostril, is called Pingala, which is heating, which is called a sun energy, which is sympathetic. Left nostril is parasympathetic and controlled by the left side of the brain, which is analytical, which is heating. The crossover of those Ida and Pingala, those are the junction of all your chakras, wheels. Each chakra is being assigned with a nervous plexus. Each chakra has a connection with your endocrine glands. Each chakra has a connection with the different systems of our body. Each chakra has that independent color. Each chakra has their independent function, and starting from the root up to the crown of your head. Violet, they put a violet on the crown. Indigo, they put down in between an eyebrow. This is called your Sahasra chakra, crown chakra. In between eyebrows is called Agga chakra, indigo. Blue at the level of your throat, it's called a throat chakra. Green at the level of your heart, called a heart chakra. So Vishuddha chakra is called Anahata chakra. Yellow at the level of your belly button is called, at the level of spine, at the level of belly button, Manipur chakra. Between your belly button and the root of the spine, behind your pubic bone,
is in the pelvis, is called Swadhisthan Chakra. Color is orange. And the root of the spine is called your Muladhara Chakra or the root chakra. Color is red. For the shape, the root chakra has 4 petals, and they're in balance. I'll show you the practice which to balance. The pelvic chakra, Swadhisthan Chakra, has 6 petals. The one at your belly button, the Manipur Chakra, is about 10 petals. One in your heart chakra, Anahata Chakra, has 12 petals. One in Vishuddha Chakra, which is at the level of your throat, has 16 petals. One at the level of your third eye, it's called Agga Chakra, has about 2 petals. One in the crown has 1,000 petals, called your Sahasra Chakra. Functionally, the root chakra is a power. People's power lies from the root chakra. From the pelvic chakra, Swadhisthan Chakra, comes your procreation. Every human being, every animal in the world have to live their progeny, that procreation. And at the level of your Manipur Chakra, at the level of your button, it's called control. Digestion controls you very much. Power, procreation, control. These are called animal instinct. When you come to your heart chakra, Anahata Chakra, the function is your love. L-O-V-E, love. The love is a connector. Love is the connector between your lower chakras and upper chakras. At the level of throat, the Vishuddha Chakra, it causes your communication. At the level of your Agga Chakra, it is your intellect. At the level of this is your bliss. What a beautiful connections they have made. When you go back to look at the connectivity between the systems, the root chakra is connected to your musculoskeletal system, bones, joints, muscles. It is connected through your sacral plexus and is connected to your adrenal gland. Power. The pelvic chakra, Swadhisthan Chakra, is connected to your reproductive system, connected to your hypogastric plexus, connected to your ovaries and testicles. Manipur Chakra at the level of your belly button, connected to your gastrointestinal system, connected to solar plexus in the endocrine organ of your pancreas, beta cells and islet cells. Remember, when you have a functional disorder of these systems, you meditate more on these chakras. And we'll show you the meditation, we'll show you the sounds, and show you the balancing. At the level of your heart, you're connected to the cardiovascular system. The function is love, cardiovascular system. Connected to endocrine gland, thymus. Nervous is a cardiac plexus. At the level of your throat, which is your throat chakra, the color is blue, connected to your respiratory system, communication. Connected to pharyngeal plexus. Connected to your thyroid and parathyroid glands. Aga chakra, sixth eye chakra, connected to your endocrine system. Function is intellect. It is connected through your parasympathetic tone and is connected to your master gland, pituitary gland. Sahasra chakra, up in the crown, is connected to your nervous system. Function is a bliss. It's connected to your cortical part of your brain and also the emotional brain, which is called a limbic system of your brain. There are two nuclei called amygdala and hippocampus. And it is connected to your pineal gland. This is with the pituitary gland, this is the pineal gland. And in the pineal gland, when you look at your brain, this is called a third ventricle. Third ventricle in yoga philosophy have been described as called a Brahma's cave. It is a cave of the Brahmas. Third ventricle is a functioning of your transcendental from your root chakra to your crown chakra. And these chakras are in imbalance. They have a potential spiritual energy and they get the ascending of the chakras, and when your power, the Muladhara chakra, becomes ascends to the level of your Sahasra chakra, that is called the crown, you develop the self-realization. You get a complete cure of a disease. In yogic tradition is called Kundalini Jagaran, ascending of your root chakra to your crown chakra. Now, what are since are in balance? Look at what we can. So, a grounding posture will balance your root chakra, which is connected to musculoskeletal disorder. So a wonderful practice will be the Bhajarasana. So if you are able to sit down, if you want to do it with me, you can sit down. Vajrasana, first of all, you can sit down on your heel, keep your spine straight. It really keeps your spine straight, supports your head. It is a wonderful practice to activate your parasympathetic tone. Slowly and slowly, you can sit down in a grounding pose. Lotus pose, thunderbolt pose will balance your Muladhara chakra. Pranayama, another important thing, I forgot about this one. In Ayurvedically it says our existence is a body, mind and spirit, and body is composed of 5 elements called Pancha Mahabhuta. The universe has 5 elements. Like universe is made from your 5 elements. There is no Big Bang theory. Universe first had a space. First has a space, and then the space, there came air. Air had a friction caused fire. Fire melted the cloud from water. Water froze into earth. Space, air, fire, water, earth. 5 components of our body, physical body. Then you have a mind or the spirit.
And these are all connected also through your chakras. So the root chakra, Muladhara chakra, is connected to your earth element. Pelvic chakra is connected to your water element. Your Manipur chakra or solar plexus chakra is connected to the fire element. Heart chakra is connected to your air element. The Vishuddha chakra or the throat chakra is connected through your space element. Space, air, fire, water, earth. Then your third eye chakra is connected through your mind, and crown chakra connected through spirit. Body, mind and spirit balance. So this Muladhara chakra, the component is your earth, and you have a grounding pose. Pranayama will be your Kapalbhati Pranayama. So Kapalbhati Pranayama, all of you know, you put the hand in a mudras, you have a balloon here, you have a diaphragm here, another balloon here, you push your balloon back, air comes out. Detoxifying pranayama. So push, if you're new to practice, you put your hand there and air comes out. If you're new to the practice, you can look at all my YouTube channels. I have all the pranayamas, you can do the pranayamas, or I have my videos, DVDs, you can do the pranayamas. Kapalbhati pranayama. Since it is a strength, Shakti, strength, you do Shakti Mudra. Shakti Mudra is called your touching your ring finger, little finger and thumb. This is also Prana Mudra. So grounding asanas, Kapalbhati Pranayam, Shakti Mudra, Prana Mudra, and bandhas is called Mula Bandh. Mula Bandh is you breathe out first, take a deep breath in, completely breathe out, suck your whole pelvic floor, anal canal and pull it up. It's like a Kegel maneuver. Mula. And the sound to balance the mantra is called a lam. So we'll do the mantra balancing at the end. Next is your pelvic chakra, Swadhisthan Chakra. The asanas, balancing asanas will be your Malasana. So sit down in the Malasana. This is to balance your pelvic chakra. Swadhisthan Chakra. Pranayama here will be the same, Kapalbhati Pranayama. Remember, we are so relaxed in every, even you can do here, you can do Kapalbhati Pranayama. The component is water, so the water component mudra is called Varun Mudra, which touches your water. Remember, the 5 elements, space is in the finger, air is in the index finger, fire is in the thumb, water in the little finger, and earth in the ring finger. So the Varun Mudra. And your locks will be your, again, Mula Bandh. And the sound is a Vam. Third is your Manipur chakra, solar plexus chakra. Asana will be your balance chakra, say your Vacration, spinal twist. Feet in front, leg at this side, You move your right knee towards, left hand comes outside, right hand goes to the back, hand comes down, touches your knee. Breathe out first, take a deep breath in, slowly turn your body away from you. Balancing your Manipur chakra. Pranayama here will be your Bajju Pranayama. It's like you do your Udyani Bandh and do your Agnisar Kriya. Mudras will be your, because it is a fire component, Pashan Mudra. Pashan Mudra or Apana Mudra. Middle finger, ring finger and thumb. Put the Pashan Mudra, and your locks, bandhas will be your abdominal lock, Udyani Bandh. So you will see your pranayama and the locks will be together. So the way to do it, you breathe out first, and you do it all for your functional disorders for your Mula chakra. This is your Pashan Mudra. You're sitting very comfortably. You can always sit in that. Vacration also. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in, hold, and then move back and forth. The sound to balance this mudra is Ram. Lam, Vam, Ram. See, all the mantras ends with a Ma sound. Heart chakra, at the level of your heart, the asanas will be chest opening poses. Bhujangasana, cobra pose, or your bridge pose, or your Paschim Namaskar, chest opening pose. Another is called your Dan Bakho Vikas Dan, opening your chest opening poses. If the component is your air, so the pranayama will be alternate nostril breathing. And the air is your index finger, so the mudras will be Vayu Mudra. Put index finger down, tap in the top, Vayu Mudra in one hand. You are in the chest opening poses, your chest is open, you are doing alternate nostril breathing. Close your right nostril, breathe out through your left nostril. Breathe in through your left nostril. Close your left nostril, breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. These are all in my book and on my DVDs, so you don't have to remember. They're all there in front of you. For the throat chakra, your asana will be, remember, its element is the space, is your respiratory system, communication. Asanas will be the Brahma Mudra, relaxation of your neck. You do the Brahma Mudra as an asana for your Vishuddha chakra. Pranayama will be Ujjayi Pranayama. Constrict your larynx, try to breathe in. Mudra, it is a space, so you do your Shunya Mudra. Touch your middle finger and thumb. And your locks will be your chin lock, Jalandhar Bandha. So we'll show it to you. We have already shown it to you how to do the neck movement. you are doing your Shunya Mudra, will be doing the Ujjayi Pranayama and incorporate Jalandhar Bandha same time to balance. Breathe out first. Take a deep breath in. Completely breathe out. The mantra for the heart was the yam. Mantra will be hum. Lam, vam, ram, yam, hum. The mantra for here will be sham. The asanas will be here. For the chakra will be balasana, like a baby, or your shashanka asana, put your head all the way down, or even can you do your sarvanga asana, asanas. Pranayama will be the mind, the pranayama will be your Brahmari pranayama. Bumblebee breathing, which is showed to you. Mudras will be your Dhyana Mudra or a Jnana Mudra, and your locks will be your chin lock. The pranayama also here you can do called Om Pranayama. Om Pranayama, the way to do it, just you breathe out first, take a deep breath in, breathe out with the sound of an Om, like this. Take a deep breath in. For the crown chakra, the asana will be a Shirshasana with a headstand. Pranayama will be the Pranaho Pranayama. Pranaho Pranayama is the three component, A, U, Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. A, U, Ma. Mudra will be again Dhyana Mudra, Jnana Mudra. And Bandha will be your Mahabandha, great lock. Like your root lock, Udyani Bandh, and a Jalandhar Bandh, all three together. That is called your Mahabandha. Let's do a Pranaho Pranayama. So Pranaho Pranayama is that you have your hand, Dhyana Mudra, you will be concentrating in the lower part of the lung. And remember, the yogic breathing is a three-stage breathing. The first one, A, will be the lower part of the lung. So breathe out first. Take a deep breath in. Bring your awareness to the middle part of the lung. It will be U. Breathe out first. Deep breath in. Bring your awareness to the upper part of the lung.
will be Ma. Breathe out first. Deep breath in.
Let's finish with a chakra awakening meditation. We'll be balancing with all the mantras. Sit down comfortably, sitting in a chair or sitting, let's do your Sukhasana, Siddhasana, Padmasana. Hand with your Dhyana Mudra, Jnana Mudra. Bring your awareness to the root of the spine. It is an imbalance. The balancing sound is a lum. Let's do all together. Breathe out first. You will take a breathe in and breathe out with the sound of a lum. Lam. Bring your awareness between belly button and the root of the spine behind the pubic bone. Swadhisthan Chakra, you have all the attributes. Sound is one. Breathe out first. A deep breath in. Vam. Chakra, connected to gastrointestinal system. You will meditate on all these 7 chakras, but if you have one particular disease of a system, you will meditate more on that chakra. Sound is Ram. So breathe out first. A deep breath in. Ram. Heart chakra. Sound to balance is Yam, quite like in Yam. You'll do more on if you have a cardiovascular disease. Breathe out first. A deep breath in. Yam. Vishuddha chakra, connected to respiratory disease system. You will do more if you have a respiratory disorder. Sound is a hum. Breathe out first. A deep breath in. Hum. Connected to your endocrine system. So your endocrine problem, thyroid problem, you meditate on this chakra. Sound here is Sham, S-H. Breathe out first. Take a deep breath in. Sham. Bring your awareness to the root, bring your awareness to the crown chakra, connected to nervous system. So we'll do more on this if you have a nervous system disorder, like multiple sclerosis, Parkinson's disease. The sound is to balance this chakra is Om. In yogic tradition, Om is a three component, A, U, Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. So breathe out first. Take a deep breath in. Slowly bring your hands in front of your heart chakra. Touch your little finger and thumb. Separate your ring finger, middle finger and index finger. It is a Padma Mudra. It connects your body, mind and spirit. Slowly bring it close to your heart. Heart is the site of the soul, and a practice of yoga therapy will balance and cure the three bodies: gross body, subtle body, causal body, sthula sharir, shukha sharir, karana sharir. 5 sheaths: foot sheath, annamaya kosha; breath sheath, pranamaya kosha; mind sheath, manomaya kosha; intellect sheath, vijnanamaya kosha; and blissful sheath, anandamaya kosha. You'll balance your 7 chakras: root chakra, Muladhara chakra, pelvic chakra, Swadhisthan Chakra, solar plexus chakra, Manipur chakra, heart chakra, Anahata chakra, throat chakra, Vishuddha chakra, third eye chakra, Agga chakra, and crown chakra, Sahasra chakra. We are completely cured of all of our dis-ease with our effortless practice, and finish again with a pumping and cupping, the most relaxing practice we ever had. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hands, if you're wearing glasses, remove your glasses, make the hands like a cup, put it over your eyes like a cup, massage your forehead, massage your eyes, massage your ear. Very important, auricular branch of the vagus nerve, in the behind and the front and inside the canal, and slowly bring it here. Massage your carotid sinuses and in the back. It's a wonderful practice. Thank you for joining. This is the philosophy of medicine. This is a little esoteric, but I hope you understood. If not, it is all recorded. This will be uploaded in the YouTube. You can go ahead and take a look at it. And as I said, when I even started reading yoga philosophy and Ayurveda, I read it first time, couldn't understand anything. Second time, little bit. Third time, when I understood it, it just stuck to my body and mind. Now I cannot leave home without this philosophy. Next Saturday, I will probably do a whole day yoga teachers training class, and it may be an introduction to yoga therapy. So we'll do the practice. We'll come back to the same time, 9:30 to 11:30. Our practice may be a little different at the time. That practice may be called Introduction to Yoga Therapy. That will be very applicable to all of you. Thank you for joining. We'll see you again next Saturday, same time, same place, Facebook Live at 9:30 a.m.